New figures suggest that more than 1 million people in Britain are now living with a dangerous heart condition which can lead to strokes. The British Heart Foundation says many people with atrial fibrillation will be unaware of it until they suffer serious health problems. It says the causes include binge drinking and an ageing population. Let's speak to Professor Nicholas Peters, Professor of Cardiology at St Mary's and Hammersmith Hospital and Imperial College Healthcare NHS Trust. What exactly is atrial fibrillation?
Well, Tim, are you aware of your heart beating now?
No.
No. and I'm not either. And in fact, it's not normal to feel your heart beating. But people with atrial fibrillation do feel their heart beating. They feel it doing a hop, skip, and a jump. Quite chaotic, often quite rapid. And that's the cardinal feature of atrial fibrillation.
So it's irregular heartbeat, is it?
Correct. It's the most common heart rhythm disturbance. It's because of an electrical abnormality in the heart, in which the heart becomes quite chaotic in its beating. A lot of people have symptoms of it, that feeling of the irregularity, so-called palpitations, but some people are not aware of it. And it's quite a dangerous condition. It's the most common cause of stroke, which is where blood clots that form within that bit of the heart that is doing the irregularity, they often go to the brain and block blood vessels in the brain.
So people watching now, if they have those symptoms, and they can almost sort of self-diagnose themselves, and then they should go to the doctor.
Yes, exactly. It can be easily diagnosed, and that's the thing about it. There are more than 1 million people now affected in this country, but it can be quite easily diagnosed from the pulse. And it's quite easy to be taught how to feel the pulse on the wrist. I could show you now. And well, that is
it's a finger on the pulse.
Correct.
Yeah.
A finger or two on the right part of the wrist. Any doctor or GP could show an individual how to do it. If you're trained in first aid, most first aiders know how to do it.
Okay. So it's increased, I think, by 20% in the last 5 years. Now, is that because of better diagnosis, or are we going through some sort of lifestyle change which is causing these numbers to increase?
Well, it is increasing very dramatically. That's in part because it's a condition that's very much related to age. The likelihood of atrial fibrillation goes up very dramatically beyond the age of about 50 or 60 years, and therefore with the aging population, better survival of underlying heart disease so that we reach those sorts of ages, the incidence is increasing. There's also, I mean, the GPs have been doing a fantastic job on improving diagnosis and, as a result, increasing awareness amongst the general public.
So if you are diagnosed with atrial fibrillation, there is treatment and what normal life expectancy if you're taking the right medication?
Yes, well, the life expectancy to some extent depends on whether you've got underlying heart diseases. As I say, one of the reasons for the increased incidence is that we're now surviving patients better through their underlying heart diseases to get atrial fibrillation, which complicates many heart diseases, indeed many other medical conditions. There are also some other lifestyle issues. Alcohol is important, but we're not sure how much part that plays in the increase.
Just a final question. I mean, you say it's one of the causes of strokes. Is there any way of estimating the number of deaths that atrial fibrillation causes each year in this country?
It is thought to consume about 1% of the NHS budget and is undoubtedly the cause of many deaths. That's why this campaign, the British Heart Foundation Ramp Up the Red Day on the 7th of February, is so important, and why the research funding that funds my research and others in the field is so important.
Okay, Professor Nicholas Peters, thanks very much indeed for coming in.